In the United States, more than 1.5 million people get something called sepsis each year. And out of these, approximately 250,000 people die. It is more common than cancer, HIV, and heart attacks combined. Stay tuned and find out more about this serious condition. Our guest, Dr. Karen Molander, is board certified in emergency medicine and is the recipient of several professional awards and honors while practicing medicine in Silicon Valley. Welcome, Karen.
Thank you for having me.
What exactly is sepsis?
The easiest way to think about sepsis is it's our body's overwhelming reaction to an infection. It can oftentimes be life-threatening.
And what is the difference between sepsis and an infection?
So the easiest way to think about it is, for example, strep throat. When some people get strep throat, they have a sore throat, a little bit low-grade fever, and other people can develop sepsis. And signs of sepsis are so vague and varied, but typically it can be very high fevers, high breathing rate, high heart rate, confusion. All those are signs of sepsis.
And what are the most common sources of infections that can lead to sepsis?
In about one-third of sepsis cases are typically from lung. Then after that, urinary tract is the next most common, and then abdominal sources. And then after that, it's skin, and then more rarely, for example, tooth infections or meningitis.
And what causes it exactly?
So the easiest way to think about sepsis is, first of all, you have to have an infection. So a virus or a bacteria or a fungus is attacking your body. And then you have to have the overwhelming response of your immune system trying to attack that virus or bacteria or fungus. The easiest way to think about it is we have more bacterial cells on us and in us than we have human cells. And typically, our body does a pretty good job of keeping the bacteria where they're supposed to be. We've got a beautiful layer of skin that helps protect us, but sometimes that layer of skin is assaulted. You cut your finger or you scrape your knee. And then your body will start sending white blood cells to that area to try and attack and protect you from the bacteria that are trying to enter into your skin. And if the white blood cells aren't doing a good enough job, they ask for more help. And they send out more they ask for more resources. So the chemicals that they send, the signals that they send, cause your blood vessels to get more leaky and more white blood cells to go there to try and attack the infection. And sometimes they just go into overdrive. So they ask for every resource imaginable from the body. So the body all of a sudden is pumping its heart super fast, it's breathing super fast, it's mounting a very high fever because it's trying to make your body not a very fun place for these bacteria to live. You know, so if you have a temperature of 105, not many things like to be around that. So what happens then is your body sometimes can overshoot the mark and start killing its own organs or killing itself off.
Oh, I see. So what are some of the potential complications
from sepsis? So for example, sometimes if people have a very bad lung infection and you start to fight that infection, all of a sudden you can get a low oxygen level. So you can have enough damage to the lungs from fighting a pneumonia that you may have chronic lung problems after that. You may require inhalers. You know, so sometimes it can cause damage to specific areas of the body, like the kidneys. Sometimes it can cause confusion where people are just out of it. They can't explain what's going on. They just know they feel lousy. Yeah.
So who is at risk for getting sepsis? Is it the elderly, the very young?
Anyone can get sepsis, but the people who are at higher risk are the elderly and the young, or people who have chronic medical conditions like diabetes or liver failure or kidney failure, or they have a compromised immune system, for example, someone with HIV. And sometimes people are on medications to suppress their immune system. For example, if they have lupus or if they have even psoriasis and they're getting one of those injectables every month, that is actually trying to chronically suppress their immune system. So they're actually at higher risk of getting an infection and getting sepsis.
Oh, I see. So are people who are in hospitals more at risk for sepsis because they're surrounded by all sorts of organisms there?
Well, yes, it's not a very clean place. But I think that the key issue is that if someone is sick enough to be in the hospital, that's already telling me that their immune system is compromised in some fashion. So whether it be that they just had surgery, where that normal barrier that exists between the intestines has been violated, for example, if they had their appendix taken out, or if they were admitted to the hospital for a heart attack, their body's already dealing with those issues. And keep in mind, they're also dealing with bacteria, viruses. Sick people come to the hospital.
Right.
So you can see a whole bunch of people with flu in the waiting room.
Right,
You know?
right.
Yeah.
And I've heard about septic shock. What is that exactly?
So that is when your body has gone way into overdrive and you are now in a life-threatening situation. That is when your blood vessels have become so leaky that they cannot maintain a normal blood pressure. And if you cannot maintain a normal blood pressure, you can't send blood to the brain, so you get very confused. You can't send blood to the heart. You can put your heart under strain and have a heart attack. You can't send blood to your kidneys, so your kidneys start, they're not functioning as well, so you have trouble processing urine. So one of the challenges with septic shock is that that's when people are at much, much higher risk of dying. So septic shock in some hospitals in the United States can have a 50% mortality.
Oh my goodness.
Yeah.
50%.
Yes.
So that's really, really serious.
And that's part of the reason why the Medicare.gov has made such an effort to bring attention to what sepsis is, because it causes more people to die in hospitals nationwide than heart attacks, cancer, so HIV.
That's really amazing. I had no idea that it was that prevalent. So I've heard that there's a limited amount of antibiotics available for people with septic shock. Is that true?
Well, typically if someone has septic shock, they have you can have septic shock from a bacterial infection, a viral infection, a fungal infection. So antibiotics will only work for a bacterial infection. And then what happens is sometimes there are certain bacteria out there that are resistant to every antibiotic that we have out there. They've been around so long, and we've tried so many antibiotics on them in the past that they've learned how to resist those antibiotics.
And that's getting more frequent, isn't it?
It is. And I think part of it is it's difficult to develop antibiotics. I think that it's expensive, and there's not as much money in it for the pharmaceutical companies, this is in my humble opinion, compared to finding new medications for reflux or new medications for atrial fibrillation.
So what are the common symptoms of sepsis?
So this is a great question, because one of the challenges with sepsis is that it can manifest itself so differently from person to person. You can have one person with strep throat who gets a super high fever, and that is a sign of sepsis. You can have another person who just gets a high breathing rate. You can have another person who gets confused and a low blood pressure. So it's not universal. Like, for example, if someone's coming in with a heart attack, they typically have crushing chest pain and they're having trouble breathing, and then I can get a simple EKG, and that can tell me, oh wow, it looks like this person's having a heart attack. Whereas sepsis can manifest itself in so many different ways and be very, very subtle.
So now you had mentioned that somebody with a urinary tract infection can get sepsis, right?
Yes.
How about a tooth abscess? Can that lead to septic shock?
Most definitely.
Oh, it can?
It can. We have a lovely supply of bacteria in our mouth that have existed there for a long time period. And typically, we have this wonderful barrier, the saliva that we produce, that helps prevent that from happening. But when you go through a dental procedure, Part of the reason they typically give you antibiotics after that procedure is to prevent infection.
Oh, I see.
Yeah.
And so how exactly is sepsis diagnosed?
So the way that we diagnose sepsis is first thinking about it, having a concern that it will exist. So someone who's had surgery may be screened every shift they're in the hospital for signs of sepsis. Signs of sepsis typically are high heart rate, high breathing rate, high white blood cell count, high temperature. Those are the classic signs of what we call the systemic inflammatory response syndrome. So that's what we're looking for in someone who has an infection. And then there's blood tests that we can do called lactate, which can sometimes indicate that someone is having poor blood flow to a portion of their body. And if that lactic acid level is elevated, that can be a sign of severe sepsis or septic shock.
So why is sepsis so hard to diagnose? I think you've touched on it a little bit already because it can be caused by virus, bacteria.
Exactly, and there's so many sources. You can have a bad headache and a fever, so then we have to worry about meningitis, but some people have bad headache and a fever actually have a urinary tract infection. So because it can manifest itself in so many different ways, and there's so many different avenues by which the bacteria can enter the body, or viruses or fungus, we just have to have a suspicion that it exists. And then we look for those systemic inflammatory response syndrome signs. So the high temperature, high pulse rate, high breathing rate, high white blood cell count.
So when a person is first diagnosed with sepsis, how are they treated?
What we've discovered is that the quicker we're able to diagnose someone, the higher their survival rate. If there is a delay in diagnosis or a delay in giving of antibiotics in someone with a bacterial infection, their mortality rate goes up by almost 7% every hour of delay in that antibiotic.
Goodness.
So what we found is once someone is showing signs of sepsis, if we get the antibiotics in for that bacterial infection quickly and we start fluids to help hydrate them and keep their blood pressure up, that they have a much higher survival rate.
So what if it was caused by a fungus?
So if it's caused by a fungus, we do have antifungal medications to treat that, but that is much rarer and typically is in someone who has a chronically suppressed immune system from either chemotherapy, from HIV, or let's say they're a heart transplant patient where they have to be on chronic immunosuppression agents. Yeah.
So are there any residual effects in the patient after getting sepsis?
Yes, unfortunately, I think that's one of the things that people are discovering now more than they did in the past is a lot of people expect after they have pneumonia, for example, that they can go out and still run that marathon in a month. And they're a little bit surprised that they feel fatigued, that they're having trouble with thinking as clearly, that their lung power is not as strong as it used to be. One source of information that's been really helpful is the Sepsis Alliance organization. They have a website called www.sepsis.org. And they go through some of the signs and symptoms that you can expect after surviving sepsis. And they have wonderful stories on there from people who've had sepsis from every possible source. Pneumonia, urinary tract infection, they have the whole bunch. A toothache.
Well, since there's so many different sources of sepsis, is there anything at all that we can do to try to prevent sepsis?
Definitely. Get vaccinated. So this year, especially with the flu epidemic, the patients who received the flu vaccine, although it wasn't 100% effective, they tended to have a more mild flu. The patients that ended up typically being admitted to hospitals in the Bay Area with flu this season had not received the flu vaccine.
Oh, is that right?
Yeah. The other thing, wash your hands. Wash your hands, wash your hands, wash your hands. That is extremely important. Cover your mouth, you know, when you're coughing to prevent giving infection to those around you. You know, and when you're sick, stay home. Don't try to do grocery shopping. Don't try and run a bunch of errands. You know, let your body rest. That's what it needs.
Good advice.
Yeah.
So is sepsis contagious?
Absolutely not.
Oh, good.
You know, there was a survey done that showed about 39% of people errantly believed that sepsis was contagious. But there are ways of getting infections, from viruses, bacteria, funguses, and there are varying levels of how contagious they are. For example, norovirus. A lot of people know about norovirus from cruise lines or from dorms.
Right.
That is a very contagious virus. It can live on a doorknob, it can live on a countertop. And when you're in a confined space with norovirus, which causes the equivalent of what we call the stomach flu, where you have nausea, vomiting, and diarrhea, you are exposing a lot of people to virus with your emesis, with every other body fluid that's coming out. And if it's not cleaned effectively with really strong bleach cleaner, other people can get it. And the other challenge is this virus is so strong that the hand sanitizers that you use don't work. So you need to wash your hands. So that is a very contagious virus, for example. But other viruses, bacteria, fungi are not necessarily as contagious as that.
So I know that about 250,000 people die from sepsis each year. Is there anything that could help make that number better?
Well, one of the things that we've found is the most important is early detection. Because again, how I talked about earlier, if it's a bacterial source, if we think it's an infection in the lungs or the urine, if we start that antibiotic with early detection at the first sign that someone's temperature is going high or their heart rate's going high or their breathing rate's going high, then their chance of survival is much better. Every hour with delay from diagnosis and administration of antibiotic, again, 6.7% increased mortality. So if you get diagnosed at 6 p.m. and they don't have that antibiotic in you until 4 in the morning, you're at much higher risk of dying.
I see. So is sepsis more common now? I've read that it's on the rise in the United States. Why is that?
I think there's multiple reasons. So one of the things is more people are surviving from stroke. With all the wonderful interventions that we have, more people are surviving from heart attacks. More people are surviving from cancer. To live to a riper age and have a somewhat compromised immune system as they age. And again, as I told you, we have more bacteria on us and in us than we have human cells. So we're at risk. We're walking petri dishes is the easiest way to think about it. But I think the other thing that's occurred in the last 2 decades is an increased awareness of what sepsis is. In 1980, 1990, we still weren't using a common language amongst physicians. One physician might write on a chart sepsis. Someone else might write bacteremia. Someone else might write pneumonia. Someone else might write septic shock. Someone else might say blood poisoning. So they were not using the same definitions for what sepsis was.
This was back in the 80s?
80s and 90s. And
so not all that long ago.
No. So there was a consortium of critical care doctors, internal medicine doctors, emergency medicine doctors that held a conference of both European and American physicians. And they said, we have to come up with a common definition so we can all figure out what truly is the incidence of sepsis, how common is this, and what are we going to say are the signs of sepsis? Because as we talked about earlier, it can be so different from person to person. So after that was developed, that language started being used more commonly across states, across countries, so we could get a better sense of truly how common sepsis was.
You know, that's really amazing because that was not very long ago.
No.
Now, you had talked about septic shock, but also there's something called a septic shock syndrome. What is that?
Toxic shock syndrome? So toxic shock syndrome was a common entity in, I'm trying to remember, I think it was like the late 80s that was associated with a typical, a particular brand of tampon. And so it was an illness that was killing women who normally you would think of as healthy young women in their 20s and 30s. And what they found was that for some reason, this particular brand of tampon would be a nice breeding ground for staph bacteria.
Just one particular brand?
It was very absorbent, and so maybe women weren't changing as frequently as they normally did.
But the other brands were not affected?
It was the one most commonly associated with it, but you can still get toxic shock syndrome to this day. It's just that the incidence is not as common as it was when that tampon was on the market.
Oh my goodness.
Yeah.
That's kind of frightening.
Yes, yes.
So you're talking about toxic shock as opposed to septic shock?
Exactly. So again, this was before the common terminology happened. So this was in the 1980s, and then, I think it was in 2000 that they had this consortium of doctors saying, please, can we use the same terms? So I think that's part of the reason why you don't hear the term toxic shock syndrome. These days, we would say patient with septic shock secondary to Staph aureus. Okay.
Oh, I see.
So, doctors in our lingo, we've got lingo for everything.
Now, we've had a particularly bad flu season this year. So can people get sepsis from the flu?
Most definitely. So I think that one of the surprises this year is that a lot of people don't understand that viruses can cause sepsis. And the flu definitely this year has been brutal. It's been giving people high fevers. It's been compromising their breathing. It definitely has been causing them to have a fast heart rate in some cases. So we have seen a lot of sepsis with the flu this year. And again, the people that we're seeing who look that ill typically have not gotten the flu vaccine.
Oh, what a shame.
Yes. Yeah.
So the word still hasn't gotten out to people?
Unfortunately, no. And some people sometimes have the false impression that they're getting the flu from the flu vaccine. But it's typically, you can get a killed virus form of the vaccine or a live virus form of the vaccine. Typically, the shot is a killed form of the vaccine. Mm-hmm. The nasal spray is the live form of the vaccine.
Oh, it is?
Yeah. But it's been hobbled, or it's not meant to cause active infection.
Right.
What it's trying to do is ramp up your immune system, saying, if you see this virus come along, be sure to take care of it quick and fast before it makes me feel miserable.
Now, why would somebody get a nasal form instead of the shot?
I think that some people were avoiding shots because they have a fear of needles.
Oh, okay.
They don't want to cause, and trying to convince your 8-year-old child to get a shot sometimes is a challenge. So I think that's why it was popular a few years back.
But it's no longer popular?
It's not as popular as the injection. Yeah.
Well, thank you, Karen, for really educating us on this very, very serious condition.
I'd like to let you know, too, how much better we're doing with management of sepsis in the Bay Area.
Oh, yes.
So when I was first starting at my hospital, mortality from septic shock was as high as 50%.
Oh, my goodness.
And it has improved tremendously with the use of these screening tools that were developed for both nurses and for physicians, so that each shift when a patient's in the hospital, they're screened for signs of sepsis.
Oh, they are?
Yes. And the other thing that we've done is we've also have you screened when you come into the emergency department. For example, if someone's saying, I'm just not feeling well, and we ask a number of questions to see if they're at increased risk of developing sepsis or septic shock. And one of the other things that we did was we developed this entire program for the Sutter-wide system, and it took a large number of very intelligent people to work on this project and develop it for our computer system and for the nursing staff and the physician staff. So the mortality at my hospital has gone down from 50% down to 7%.
Oh, that's fantastic.
And one thing that you can do is investigate and see how your local hospital is doing. So Medicare.gov has statistics on how well hospitals do for management of childbirth, for heart attack, and they also have statistics on sepsis and pneumonia management, for example. There's also websites called Hospital Grades. There's another one where they grade hospitals to see how effective they are. So I think it's an important tool to look up and see just how good your local hospital is at managing this.
Absolutely. That's really good information. That's Medicare.gov, is
Yes.
that right?
Yes.
Thank you again so much for being with us and
Sure.
enlightening us.
Thank you.
Our thanks to Dr. Molander for shedding some light on this very serious condition. And thank you for watching, and be sure to watch us on YouTube and Roku. See you next time. Bye-bye.